So today I'm going to talk about eosinophilic asthma and an herb called Chuan Bei Mu. And eosinophilic asthma is considered a subtype of regular asthma. It tends to occur in people once they're a little bit older. Usually with asthma, the traditional thinking is it starts at a younger age. You might have other atopic diseases like eczema, but eosinophilic asthma is a little bit different. You tend to see it in a little bit older patients, and they don't necessarily have the atopy or the eczema or other types of symptoms that you would see in more traditional childhood asthma. And the main thing also is that you see higher levels of eosinophils or white blood cells, which is where the name comes from, eosinophilic asthma. And there are treatment options in Western medicine, but I wanted to talk a little bit about Chinese medicine and a herb called Chuan Bei Mu. And this is a herb in Chinese medicine that's been used for a long time, especially to help pulmonary problems, to help lung issues. It's an herb that actually goes to both the lungs and the heart. So in Chinese medicine, the lungs and the heart together in the upper part of your body have a lot of interrelated function. And one of the things the herb helps to do is it's said to help descend the lung qi. So a lot of times when we're coughing in Western medicine, we call it coughing, and we don't have a good reason as to what's happening physiologically. But in Chinese medicine, the idea of coughing is that the lung qi is ascending improperly when it should be actually descending. Shun Bai Mu is an herb that helps to descend the lung qi. And in cases of asthma, eosinophilic asthma, if the presentation in Chinese medicine fits, which is that there's heat and there is phlegm in the lungs, that the lung qi is redirecting upwards and properly, Shun Bai Mu is actually a great herb that can be used to help with eosinophilic asthma. It's usually used in conjunction with other types of herbs. One of the common ones is Xingren, and we'll probably talk a little bit about that at a later time. But it can be used for eosinophilic asthma, and the important thing is that you are able to match the symptoms with the indications for Chun Bai Mu. And it is also one of the key things it does is it helps to moisten the lungs and nourish the lungs. Sometimes you have dryness in the lungs. You might have phlegm, but that still is considered, it can be a dryness present with it. And so you might have dry cough, a lot of sputum production, a lot of coughing. And those are all indications for Shun Bai Mu used in conjunction with other herbs, particularly for your individual condition. So eosinophilic asthma and Shun Bai Mu. We'll see you next time.